Hi, my name is Taylor Garcia, and I'm going to be introducing our in-service project on burnout in physical therapy with Brian, Trinity, Grace, Tony, and myself. The term burnout refers to emotional exhaustion, depersonalization, and lacking personal accomplishment. Burnout is common in careers with high workloads, emotional demands, administrative burdens, and productivity pressures. We often see this in physical therapy. The meta-analysis by Coppola et al. Found that burnout in physical therapy is comparable to that in physicians and nurses. It highlights the importance of identifying burnout and implementing strategies to reduce it.
Hello, my name is Trinity, and I will be discussing the relevance of burnout to physical therapy practice. Burnout isn't just a challenge for individual therapists, it directly impacts the overall clinic environment. When clinicians experience emotional exhaustion, it affects their well being, their ability to connect with patients, and ultimately the quality of care delivered. Burnout also contributes to higher staff turnover, increased absenteeism, and a greater risk of clinical errors. Addressing it is essential, not only for protecting therapists' health, but also for ensuring safe, consistent, and effective care. To effectively manage burnout, we need a multi-layered approach. First, adjusting workloads and schedules is essential. This means implementing flexible scheduling, setting reasonable caseload limits, and making sure that regular breaks and time off are prioritized. Second, promoting mindfulness and self-care helps build resilience. Simple evidence-based practice like breathe techniques or short meditations, regular exercise, balanced nutrition, and adequate sleep can significantly reduce stress levels. And finally, strong organizational and peer support is key. Creating a safe space for team discussions, offering structured peer support programs, and maintaining transparent, responsive leadership helps to foster a collaborative environment where therapists can thrive and continue delivering high quality patient care.
Hi, my name is Grace, and I'll be discussing how burnout relates to the APTA Code of Ethics, focusing on Principles 1 and 5. Starting with Principle 1, it's about respecting the dignity and rights of all individuals. Burnout can make it harder to show empathy and provide compassionate care, which directly impacts how we treat our patients. Principle 5 involves meeting our legal and professional obligations. When burnout is chronic, it can impair our judgment and clinical decision making, potentially putting patient safety at risk. By managing burnout, we're not only protecting ourselves, but we're also staying true to the ethical standards of our profession. For this slide, I'll be talking about how team dynamics and interprofessional collaboration play a role in reducing burnout. Supportive teams can make a big difference. When communication is clear and everyone understands their role, a positive and manageable work environment which helps prevent burnout. Interprofessional collaboration is also essential. Sharing responsibilities with professionals like occupational therapists, nurses, and case managers can ease the workload and reduce stress, allowing us to focus more effectively on patient care. Together, these strategies promote both team efficiency and clinical well-being.
Hello, my name is Tony, and I will be discussing diversity. As my colleagues have stated, when we talk about burnout, we normally focus on high workloads, productivity pressure, and stress. But we also have to consider how burnout can disproportionately affect minorities or marginalized staff. Factors like discrimination, microaggression, or simply feeling excluded can add a visible weight to burnout that others may not see. Imagine showing up to work where you're constantly thinking about how you are perceived, where your ideas and efforts are overlooked, and where you are subtly reminded that you don't belong. That's why diversity, equity, and inclusion matter in this conversation. A workplace environment that is inclusive can help people feel like they belong, and the feeling of belonging can make people more resilient in the face of stress.
To wrap up, here are 5 actionable takeaways you can bring to your clinical setting. First, implement a burnout self-assessment tool every few months to stay proactive. Second, schedule regular team check-ins to foster open dialogue around stress and workload. Third, advocate for institutional policies that support therapist well-being, like realistic productivity expectations. Fourth, foster interprofessional mentorship. Sharing challenges across disciplines can build a stronger support system. And finally, integrate the APTA Code of Ethics and the RIPS model into routine training to keep ethical practice and professional resilience front and center. And these are our references. Thank you for watching our presentation.